My name is Brian Moore. I'm an assistant professor of psychological science in the Norman J. Radow College of Humanities and Social Sciences. In the past 20 years, there have been a proliferation of media that displays the traumatic stressors that military personnel experience in service to their country. Very few, however, focus on the why some service members cope with trauma exposure in a healthy manner, while yet others do not. Following graduation from college in 2009, I joined the Army as an infantry officer. As a young lieutenant, I served as a platoon leader for a group of 45 soldiers who had just returned from a combat deployment to Afghanistan. In this and subsequent positions, I witnessed firsthand how combat exposure impacts the behavioral health of soldiers and in turn their families. I began searching for ways I could assist soldiers in building their resilience to stressors. At the time, I had no idea this would lead me to where I am now. Much later, I was in Iraq and met a research psychologist who encouraged me to pursue a PhD in military health, specifically surrounding the impacts of trauma exposure. While in graduate school, I became increasingly interested in how the body and mind interact to impact overall well-being, and how traumatic stressors experienced early on can negatively impact individuals, their families, and communities. To advance the science surrounding military health, interventions and data collection efforts must be grounded in the culture of each military group. In this instance, a group that is composed of 6 or more extraordinarily distinct yet interrelated elements. Understanding military culture is critical as a consideration of military research, being composed of largely one single area, allows for a limited view of the spectrum of considerations that should be at the forefront of our minds when considering access to care, intervention development, or even resources available to advance research. As a relatable example, let's consider how trauma exposure impacts an individual and how those stressors may in turn impact immediate family members and the communities in which trauma occurs. To envision this, we could use COVID-19 to consider how traumatic stressors impact communities. In many areas, COVID-19 has been devastating. People have lost loved ones, employment, education opportunities, they've experienced behavioral health concerns, and the list goes on. Without targeted and appropriate interventions, these setbacks could potentially create negative events for families for generations. In many ways, this is similar to how combat trauma can impact service members, their families, and communities. Fortunately, just as we now have vaccines for COVID-19, there are incredible first-line interventions for the treatment of military trauma. My research focuses on advancing our knowledge of trauma and health concerns in military personnel and aims to help service members build resistance to stressor exposure. In fall 2020, Dr. Paul Story in the Department of Psychological Science and Dr. Yuri Feito in the Department of Exercise Science and Sports Management and I began an interdisciplinary study examining the interrelations between psychological well-being and injuries sustained in military basic trainees at Fort Benning, Georgia. Very little research has been done in this area. Because of the I-cubed opportunity, we now have longitudinal data on nearly 900 military basic trainees and are examining injuries and family dynamics related to service. Related to this project, we have also been able to establish ties with the military community in the KSU area and have held numerous meetings with Georgia Army National Guard leadership. We anticipate this project and the connections made will facilitate the development of unique interventions to reduce the impacts of trauma. Although this is exciting for us, this research is simply a start to better understanding how stressors experienced early in their careers impact service members, their families, and communities. From here, we can begin to develop interventions that can prevent or further reduce the negative impacts of physical and psychological stressors.